Hi, I'm Prithviraj Bose from the Leukemia Department at MD Anderson Cancer Center in Houston, Texas. So Momelotinib is a JAK1, JAK2 and ACVR1 inhibitor that was approved in September 2023. So really the newest of our 4 approved JAK inhibitors. And really the big unmet need that momelotinib was able to fulfill was that it's a JAK inhibitor that improves anemia, so that not only does it not cause much anemia, it actually improves anemia. Ruxolitinib, which is Jakafi, fedratinib or Inrebic, these do not typically improve anemia. In fact, they tend to cause anemia, and that's been a problem. So momelotinib or Ojara, this was a very welcome new addition to the arsenal of JAK inhibitors because of this anemia piece. Now, momelotinib has been extensively studied in 3 large phase 3 trials, the Simplify-1, Simplify-2 and Momentum. And Simplify-1 and Momentum are the 2 that were used in the labeling of momelotinib. Now, Simplify-1 is a frontline trial head-to-head of momelotinib versus ruxolitinib, so Ojara versus Jakafi. Momentum is a second-line study of momelotinib versus danazol in patients who had already had JAK inhibitor therapy and were anemic and symptomatic. Both were large phase 3 trials. So Simplify-1 actually showed that ruxolitinib and momelotinib were the same for spleen, although for symptoms, actually ruxolitinib was better. Now, for all the anemia-related measures, predictably, momelotinib was better. Now, moving on to Momentum, the second-line study, here the comparator was danazol, and momelotinib was superior for spleen and symptoms and, of course, for anemia. So those are that's kind of the big picture and the things that momelotinib does at a very high level. Now, if drilling down to this particular abstract that we are presenting at EHA, or that I'm presenting at EHA, this was a look specifically at intermediate 1 patients versus intermediate 2 or high-risk patients enrolled in Simplify-1 and in Momentum. So in the 2 pivotal trials that the FDA used. And the idea was, let's see if the benefits are any different in one of these subgroups. We've learned from Rux, for example, Jakafi, that intermediate 1 risk patients generally have higher efficacy and lower toxicity. So that was sort of the idea to look here as well to see what happens. Now, generally, that same thing held true here, where the benefits or the response rates in terms of spleen symptoms, anemia, were higher in the intermediate 1 patients, which makes sense because they are earlier in their disease, they are less sick basically. And so with any therapy, with any cancer therapy, it actually makes sense to use it earlier. So just as we've learned from ruxolitinib, sort of the same thing held true, where momelotinib did better in intermediate 1 than in intermediate 2 or high, although I have to say that the response rates were not that different. So it was actually fairly consistent, for the most part numerically higher in the intermediate 1.